In Trinidad and Tobago, prostate cancer is the most commonly diagnosed malignancy and the leading cause of cancer deaths among men. A scary statistic as many men walk around not being tested and treated. CNC3 News spoke to specialist urological surgeon Dr. Lal Sao. Dr. Lal Sao is a local urologist who has advanced the practice and research of urology throughout the Caribbean. As the numbers increase and men remain fearful of being tested, Dr. Sao has announced two new technologies that will make testing more accurate for doctors.
Although we are on the cusp of a very interesting and exciting time, we've had two major drawbacks in accurately diagnosing prostate cancer over the years. One is the imaging modality, and the other one is the confirmatory biopsies. Both had some shortcomings, serious shortcomings, and in fact complications. But that's the best we had in that era, so we had to live with it. Fortunately for now, both in our imaging side of things, our colleagues now in imaging have more precise imaging available using an MRI machine, magnetic resonance imaging.
As technology and conventional medication mix, Dr. Sao says new imaging will allow for guided biopsies.
So here you are faced with a beautiful image, accurate image, fairly accurate image, but you can't use that image in the conventional way to biopsy the prostate. So what does technology do? Very smartly. Go back to our old imaging system, which is a transrectal ultrasound, and now marry the two images. So they transfer the image from the transrectal ultrasound, or vice versa rather, from the MRI to the transrectal ultrasound. So you use your conventional ultrasound now, which is now augmented by the new image, superimposing it to get to the areas that are lighting up as high-risk areas. Now you can do the biopsies, being more guided, more pointed, and therefore being more accurate by the marriage of these two technologies.
Dr. Sao says he's very particularly concerned about the incidence of mortality in the sister isle of Tobago.
From Pittsburgh, did some very, very seminal studies in Tobago, and their figures show that the incidence per 100,000 population, people in Tobago, is highest in Tobago than in most parts of the world. I'll show you the numbers are there. 190 patients per 100,000 patients, population.
He wants the conversation to change. Dr. Sao listed a simple process of detection.
So the digital rectal exam starts the process, and then of course the blood test, the PSA. And when the combination of both or either or is abnormal, you go to the next stage, which is the imaging we spoke about. And then the imaging now will help the doctor determine should this patient be biopsied or not. And if he should be biopsied, now we go to the new biopsy, the transperineal, which reduces the risk of infection, and then that's the end of the diagnostic armamentarium.
Dr. Sao commended Prime Minister Dr. Kit Rowley for coming out publicly and saying he got his prostate checked. He says when high-profile persons share their experiences, there's an upswing in the number of people getting tested.
When our Prime Minister, Dr. Rowley, came and said on public media that he had his prostate exam done, 5 days after that, we had people coming in here. They were literally dropping their pants to have the exam. But you know, we are 5-day wonder country. On the 6th day and thereafter, where did these old men go? They disappeared. Same time, whenever any hero, any mentor, any kind of role model is diagnosed anywhere in the world, well, they're ready to have their prostate exam. But give them 3 or 4 or 5 days, forget about it, back to normal.
Otto Carrington, CNC3 News.